You're listening to Be Health Connected, a podcast by the Gateway Business Health Coalition. Your host for today's episode is Laurel Pickering, BHC President and CEO.
Hi, I'm Laurel Pickering, President and CEO of the BHC, and welcome back to the BHC's Be Health Connected podcast. Today, I'm thrilled to be joined by two of our board members, Linda Brady, who is part of the Global Benefits team at Boeing, specifically focused on healthcare and well-being strategy, and Kirsten Tidd, Manager of Health and Wellness at Spire. We are going to be reflecting on how employers are using data, sharing takeaways from the 2025 annual meeting, and looking ahead to BHC's priorities for 2026. I do want to mention that the annual meeting was a couple months ago, so we were asking Linda and Kirsten to recall their reactions and feedback and insights from that day, but we'll give them a little grace if they're struggling to remember some of the details. At the 2025 annual meeting, the focus was on using data to drive better health outcomes and value. So Kirsten and Linda, how did the meeting overall influence the way that you think about leveraging data as an employer, especially when it comes to cost, quality, and holding your partners accountable? Maybe Linda, start with you.
Sure. First of all, it was a great meeting. I get so much out of these meetings when we all gather together. The energy was so high. The way the topic came together with all the different perspectives was incredible. I left feeling optimistic and energized and with lots of ideas going off in my head on other ways I can sort of take advantage of available data that's out there. But one of the key takeaways for me, it wasn't necessarily a surprise, but it really energized me around this concept, was how we use quality when we're looking at data. It isn't just about cost, pricing, utilization. We are to make decisions about what kind of healthcare solutions we want to make available and make sure is available for our employees. We have to make sure that the quality is there. We have a fiduciary responsibility to make sure that it's there. And Leah in particular really impressed upon me about nothing changes. If you're not measuring the quality of something, nothing changes. It's a competitive requirement, a fiduciary requirement. And so when we were talking about how Leapfrog goes around and assesses the quality of hospitals and the improvements that has led to, it really empowered me to be bold in telling other, health systems around the country that are, knocking on our door to talk to us about different arrangements, direct contracting, value-based care, that we start with quality. That if you're not taking the time to complete these surveys, we don't know where you're coming at. We don't know how to benchmark you. We don't know where to start. So we have to have quality. That is our starting point. And that was kind of one of the key messages that I walked away with from the annual meeting.
For me, the trifecta is being able to provide healthcare with high quality at a low cost with provider and system accountability. Data is the key to be able to reach that metric. And of course, with everything that Linda mentioned. So data is really how we get there.
Yeah, or otherwise you're flying blind, right?
Correct.
And if you want your employees to have high quality care, which I agree, Linda, that's really, I think, the right starting point. Everything else flows and follows from there, right?
Yeah.
Well, you already started touching on Leah's Binder's presentation. So Leah Binder, president of the Leapfrog Group, gave, a powerful example of data in action and how employers can use that information to protect employees. And, I have experience with Leapfrog. I was on the board, and one of the ways that I always thought about the Leapfrog data and quality was, since their focus was on safety, is like safety should be first, right? First and foremost, you want to make sure when you have an experience with the healthcare system that you're going to be safe. You're not going to be injured, God forbid, have a death, but safety should be number one. Are there other things that stood out to you from, Leah's conversation about hospital quality and safety Maybe Kirsten, start with you on this one.
I think taking a look at as far as the hospital systems and individual hospitals that actually participated from the St. Louis area, I was actually surprised at the grade. Some of our smaller hospitals, the more rural hospitals, actually had a higher grade than some of our larger, more urban hospitals. That was probably the most surprising thing for me because you would think the opposite, which was actually kind of surprising. Like I said, was kind of surprising to me. Some of the things that were shared in the presentation were some of the things that to me are back to basics: hand washing, making sure that the right medications are being provided to the right patient in the right dosage at the right time frames. Those to me seem the basics. So moving forward to provide some of the other things, that to me seems like those are pretty easy.
Linda, what stood out to you the most from Leah's presentation? You've already noted some things, but anything else that you would add? And I love that Kirsten brought up how our hospitals are performing in St. Louis, which, I'd love to talk a little bit more about as well.
It's interesting because some of the performance of the hospitals in St. Louis, the grades are a reflection of their failure to report, failure to participate. That was sort of eye-opening for me. It's like hospital systems can't escape this assessment. And I would encourage other employers to really put pressure and pay attention to these leapfrog scores. I think this kind of data enables us to make better decisions. We all complain about our U.S. healthcare system, and it is broken. There's no getting around that fact. But as employers in self-insured environments, we're paying for that. And so what Leapfrog does is it's giving us more insight along with the transparency data into literally allowing us to see what it is we're paying for. And when we can see what it is we're paying for, we have to stop and say, why? Would we do this in any other area of our business? And one of the things about Leapfrog that I also really appreciate, it's kind of twofold. One is around safety and the emphasis on safety. First, do no harm, right? That's the part of the Hippocratic Oath. And we are not using data to make sure that that is indeed the case. Or there's data available that we're not incorporating into our everyday decision making and actually holding people accountable. We can't just leave it to Leapfrog to publish these results and say, okay, we're done, and not have any kind of consequence. I think Leah told some really interesting stories about the Titanic to help sort of us understand that you can't just provide the results and the data. You have to figure out what you're going to do with it. And to me, that was, I think, a really interesting element of, I think, her plea to employers.
Yeah, I think Leah did a great, one of the things when you talk about presenting and driving home a point is storytelling, right? And so she
Yeah,
did a great job telling a story that we all know and tying hospital safety and quality to that
right.
as well.
Right. So I guess, when she was talking about that, I'm thinking, I couldn't help but make the analogy. It was a perfect story. It's like we're headed for an iceberg. I would say we've hit the iceberg and we're not prepared. And, and it's not because of lack of data.
So, Linda, you are helping us spearhead a conversation in our region with providers, right? We had what we call the Purchaser Provider Roundtable a couple weeks ago, where we brought together employers and purchasers. You were both part of that to start this conversation about our community and where do we need to focus, as buyers of healthcare and stewards of the resources we're providing for our employees, and hearing from the providers about what they're struggling with. Do you see an opportunity for employers to use this kind of data, as we start having these conversations in our community with the providers, like talking to them about, hey, you have a C grade in Leapfrog, and what are you doing to improve? And how would you tie in the data to some of the work that we're doing here locally that we've started to do?
Yeah, to build on that, it was really interesting to bring the providers and purchasers together because I think everybody recognizes we have to do something. We can't just sit back and just continue to pay more and more and more for a system that's very, very broken. Then we're part of the problem. And so bringing the providers and purchasers together to sort of share perspectives in a way, historically, there's been a middleman in between us. And that's been the health plans, the role that they've been playing. And they talk to the providers and they turn around and talk to us. And sort of having the opportunity to come to the table directly with the providers is profound. It gives them an opportunity to understand the challenges that employers face. We're not in the business of healthcare. They are. We're paying for that business, but that's not our business. We've got a core business we're trying to run, and helping them understand some of the challenges we face, and likewise helping us understand some of the challenges they face. One of the profound things that come out of these conversations is that I believe this with all my heart. Everybody wants to do the right thing. But we are in a situation, we've created an environment where we've got so many barriers, it's preventing us from doing the right thing. And I believe that data is the way out, the door out of this. And the more attention we pay that, the more we're able to connect the dots and understand what the data is telling us. There's so much data out there. It's not all usable. It's not all actionable. It's not all meaningful. And building our aptitude around what is meaningful, I think is going to be a critical success factor. But we can't do it alone as employers, as purchasers in our own bubble. Providers can't do it alone. They're sort of that's their agenda. So they're looking at, the metrics that their system has put in front of them. And sometimes they're counterintuitive to the metrics that we would use to say what's quality and what's a good experience for our members. And so because we're all operating in our own bubbles, our own silos with our own data points to sort of self-fulfill our perspective, we're not changing anything. And this is what the exciting thing is about this outcome. Bringing the two groups together, sharing our data, trying to merge it so we don't have these siloed agendas, I think going to be a giant first step in trying to improve what we're doing.
Yeah, I agree. We are really excited about that initial conversation and where it's
Yeah.
going to lead to. So, shifting gears, at the annual meeting, we were joined by Sean Greminger, who's the head of the National Alliance for Healthcare Purchaser Coalitions, which is kind of our national organization, and James Gelfand from the ERISA Industry Committee to talk about the policy landscape and the employer perspective. So policy has for a long time now aimed at improving the landscape around data ownership and access for employers. This is a conversation not only at the national level, but I testified on a bill at the Missouri State House in Jefferson City that had a provision that employers are entitled to their data and should have access to their data. So this is happening nationally and at the state level. CAA reporting has been around since 2021, yet many employers still aren't getting the insights that they need from their data or even getting the data that they need. How are you fulfilling these data reporting requirements or holding your, partners, whether it's PBMs or health plans, accountable to providing this information on your behalf? And are you using the data in any specific way?
So, I mean, obviously we are complying with that data request because it's part of our compliance requirements. The problem with that data requirement piece is that we really don't have access to that data because of the way that it's being required to be presented, right? It's difficult to access because it's machine readable, but we and the general public really don't have a way in which to be able to access that machine readable data. So it's difficult at best to be able to actually get to it. So how can we access that data, right? We can data mine our own data through, data warehouses that many employers have, or if the employer doesn't have it, our consulting or brokers have on our behalf. And those individuals do our data mining for us by going through our claims, either through our medical or through our pharmacy benefit managers. So then we're able to see what's in our claims data. But the reality is that for the general public being able to figure out what's going on, it's almost nearly impossible. They're not being able to figure out how much something is going to cost, which was the reason why those transparency rules were put into place, right? So for the general public, it's been very difficult for them to be able to access what those laws were intended to do.
Yeah, and I think you set Linda up nicely for this question because absolutely, to your point, the way the hospital transparency data is being provided is in these machine readable files that have not been accessible. And more organizations that serve and work with employers are trying to crack the code and make that usable and available in addition to, the claims data that you're getting. So Linda, love to hear your thoughts. I know you're very engaged with the Purchaser Business Group on Health, who is trying to crack the code on this as well. But I'd love your thoughts on the transparency data, employers getting access to it, and just also advice for other employers you have on how to
Yeah, and
maximize what's available.
we're just scratching the surface on this. So yes, we did. We participated in a study done by the Purchasers Business Group on Health, where they were able to take our claims data and integrate it with the hospital, the transparency data that's out there, and then tell a story with it. And one of the profound things that came out of it was, the realization that the claims data alone will never give you the insight that you need on what's going on with your dollars and how you're spending them in communities. The other, confirmation was healthcare is local. We did this study in multiple markets. It was helpful for us to see the differences between the markets, but it really is a local exercise. They were able to drill down, and we were able to look at the rate differences across carriers. We were able to look at the spend by provider, by CPT code. And the variance is not surprising, but it's still startling when you see it. And then we also added a quality data element into the study as well. So not only could you see what you're spending, you could see if you're getting the quality that you expect with that spend. And as you would expect, people sort of equate high spend or high cost with quality. And that, of course, is not the equation. So we are trying to use this data to do a number of different things. Part of it is just to confirm our own relationship with our health plan carrier and the rates that they're getting. Part of it is to understand the good actors, the good providers in a community, from a pricing perspective. It allows us to also have candid conversations where we do have the opportunity to sit down at the table with our provider partners. Oftentimes, our providers didn't even know what their quality was. They only know what the quality is in their system. Of course, they're speaking the company speak. We have the best specialists, and because they're not looking outside their own walls. We have to do that as purchasers because we're the ones that are paying, and our employees are paying for this. And so it's part of our fiduciary responsibility. Somebody once said to me, "You're not changing anything if you're not disruptive." And one of the key things about this, to see the pushback and the clapback from the sources of this data, not wanting to share this data, I think is a telling factor that this is a threat. And it does suggest that disruption is coming. And this is, it's not going to work for everybody, but it's necessary for change.
And we need purchasers like you and those, part of PBGH to lead the way on this. So thank you for your leadership in that area, Linda. So we ended the annual meeting with an employer panel, which is something at all of our events. We want to make sure that the audience, the other employers, are hearing from employers. And we had, our own board member, Missy Holmberg from Panera. We brought in Cora Opsel with 32BJ from New York. And then Linda, you also participated on the panel. And I know we're going back a couple months, but Kirsten, could you recall anything that you heard from that employer panel that resonated with you that you could share?
I do, yes. So each employer had different components that really did generate ideas. From Linda, you and your culture of continuous improvement with Boeing, and the supplier check and validate by looking at ways to improve by looking at your data. With Cora's comments about how 32BJ look at how to solve the organization's unique issues, and with Panera by getting the right information in front of leadership, like how the plan is performing and is a point solution working as anticipated, and how to show the value of certain plan design changes. Those are all key components of how to show the value of what we're doing with our health and welfare plans and our well-being plans.
Yeah, and I think it was a good showing of the challenges different employers are having and the level of sophistication as well. And Linda, I think you kind of fell right in the middle. I think Panera's at the beginning of their data journey. Cora has been at this for a number of years. And Linda, you shared Boeing's experience with leveraging on the panel. Can you briefly recap how you're using data today and what you've learned is the biggest barrier to actually digesting data and acting on it?
I'd say one of the biggest barriers is time. We have day jobs, and the data is so important for decision making. And if I had a clone, I would spend it on data 24/7. I absolutely love the data. I just don't have the time. So for us, it's about being really astute about the data that's available there, being aggressive in requiring all of our partners to provide the data we need to make those decisions so we can measure our impact and progress or lack of progress. I mean, oftentimes the data tells us something doesn't work and to turn back. But for me, it's our partnerships. It's being able to turn to MHI and say, you've got data analytic experts, you've got our data. Help me understand what's going on in specific areas like cancer. We recently just did a study with you on our cancer population, and you think you know what's going on because you have a general idea of what your cancer spend is. Yeah, it's an issue. But when you start to peel back that onion with people with that expertise, it is really profound, and it will change what you decide to do in terms of investing in point solutions, in terms of investing in primary care, in terms of how you're communicating and how you're targeting. And so for me, it's about you don't have to be the expert as an employer. You just have to use the data and know who can help you and how do you leverage those relationships. And so, I mean, I can't say enough about the analytics team at MHI, the help that they've provided us in terms of looking at our MSK spend and just doing that deeper dive that I don't necessarily have the time, or necessarily even sometimes the skill set to go into the different data environments, and they do. And so, my biggest message and takeaway is leverage your resources. Don't be afraid.
Yeah, and as we go into 2026 and planning for both organizations, BHC and MHI, which is now the Missouri Health Value Collaborative, we are looking to leverage the data analytics team that we've had at our disposal, but have not made available to our employer members. And as we've been having conversations with employers about their data, to your point, Linda, we found two things. One, they're an employer with a lot of resources. They have a data warehouse. They get a lot of reports, but they don't have time. They don't have time to dig into it. They don't have the time to use what's available to them. And then the other thing is we did find some employers don't have a data warehouse and their data is in, silos and not pulled together. And so we are able to help both employers in both of those situations. We had one employer say, "Hey, I have a data warehouse. Here's the login. Please go in and point some of these things out that you were referring to, Linda, that we can use to manage the plan and manage the cost and quality better." So we're really looking forward to getting the word out about our data analytic capabilities. We've had some great conversations already. And thank you, Linda. We're going to be using some of the work we've done for you as case studies to share with others. We are leaning into data, and that's the big message I want our listeners to take away from this conversation in the conference is that we're going to be here as a resource to help because it's so critical to employers making decisions about the plan going forward.
There's one other thing I'd added that MHI can do for you when I say leverage your resources. It's one thing to have, you see the results of what your population is doing, but you need context. You need to understand, is that good? Is that bad? What's the benchmark? What's the norm? Not necessarily that the norm or the benchmark is your target or your goal, but you need that context. And that's the other thing I think of the power of the MHI analytics. They bring that perspective to their analytics. So,
Yes, thank you. Thank you for adding that. So, Kirsten, you're a very active member of BHC and on the board, and you were at the provider purchaser roundtable. You've been listening to how we're going to make our data analytics team available to employers. You've been listening to our PBM conversations and how we are changing our portfolio and our offering to reflect, more transparency in the way the industry is going. I would love for you to just comment on, where you think BHC can make the biggest impact and what you're seeing about the value that we're bringing to you, to the members, and to the St. Louis region.
So I think continuing to see how your own organization's ecosystems data is working by continuing to review your own data along with the community partners like the BHC and MHI's data analytics to see how those health systems in your communities are working and partnering with those systems to figure out how to find the balance between cost, quality, and access. And for the BHC to continue to partner with organizations like the Leapfrog Group and have more health systems participate in that survey.
Yeah, I totally agree. I think we can take the leadership role in exposing the data, and then we have relationships with all the health systems in our market, and we can work with them on improving. I think that's the bottom line. Okay, last question. If you could offer one call to action, whether to other employers or to healthcare partners and providers, what would it be?
That is the magical question. There's just so many. It's hard to just pick one. But for the sake of this podcast, I will sort of zero in. I think it's weird to say it this way, but let your guard down. Be willing to sort of be transparent. We talk about transparency. I was doing with the project with the Purchasers Business Group on Health. We were presenting our findings, and a lot of the providers were in the audience, and we talked about, okay, we'll refer to them as provider A, B, C, and D. I was a little reluctant to sort of call them out in this big meeting, and the clinical director of the study turned to me and said, "This is a transparency project." And it made me laugh. It's like, yeah, if we're not going to be willing to just put the cards on the table, whether we look good, whether we don't look good, who has the fault, it isn't about that anymore. We have to walk the talk. Is that the expression? We have to be able to do that. And so I would say to all players in this, all constituents, we have to be willing to be open, let our guard down. The days of hiding things, being secretive, don't tell anybody. That's been sort of historically how the system sort of came about. We have to stop that or we're never going to see change.
I think we're moving well in that direction, but a
Yeah.
lot more needs to be done. Kirsten, did you have any call to action for employers, your partners, providers?
The one thing that resonates for me is really about, there's transparency, but in addition to that, be open to the innovation. To borrow an analogy, let's build a better mousetrap. We've got the data, right? Yes, we want to build that better mousetrap.
Laurel, I to just build on that, I have to add that to me is one of the biggest values of being part of the BHC and being on the board for the Missouri Health Value Collaborative. I think for BHC, being able to be in a room like where we work, we're in small teams. I mean, people
Yeah.
think, oh, you're Boeing, you have a team of like, it's where we work in small teams based on our expertise, and being able to come together as other employees and learn what other people are doing to try and solve problems and build on those ideas. That to me is one of the best things about BHC. It's like it creates that purchaser forum to do that. The Missouri Health Value Collaborative, that's where we're bringing in the other stakeholders, right? We're bringing in the health plans, we're bringing in the providers. It's about, people always say, well, we're not Boeing, we can't do that. We don't want to do innovation in a silo. We're not changing anything if we're doing it just for our organization. We have to be able to work with other employers. We have to support each other, but we have to work with the other stakeholders or we're not going to see change. And I feel like our participation in these two organizations is, that's what spurs us on.
I think
I would
this is a
agree.
great way to end this conversation. I'm going to close picking up on what you said, Kirsten, that we need to build a better mousetrap using data, and we need to do it together.
Yeah.
So thank you both for your continued leadership on the BHC board and for sharing your thoughts today. Thank you for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the Gateway Business Health Coalition, please visit www.gatewaybhc.org.